Hello and welcome. I'm so glad you're here. Today, we're going to talk about something that's incredibly personal and, for so many of us, really difficult: painful sex. I want this to be a space of gentle understanding. My hope is that by the end of our time together, you'll feel seen, you'll feel informed, and most of all, you'll feel hopeful about your path to healing. You know, if you're here, you might be carrying a quiet question, maybe a little hope that things can be different. I really want you to know that hope is so valid. This conversation is for you. It's all about rediscovering comfort and, yes, joy in your own body. So to guide our conversation, we've laid out a really gentle roadmap. We're going to start by just acknowledging your experience. Then we'll dive into the why behind the pain, discover a gentle path to relief, and you'll get to meet a trusted guide for this journey. We'll also look at what the timeline for healing really looks like, and we'll finish up with a simple, empowering first step you can take today. Okay, first things first, and this is so important. Let's talk about the reality of what you might be going through. It's absolutely crucial to start here, because your feelings and your pain, they are real. Let me just say this as clearly as I can. You are not alone. And that pain you're feeling, it is not all in your head. It's a real, physical, and absolutely treatable issue. It's your body's way of signaling that something needs attention. And pelvic floor physiotherapy is all about listening to that signal and getting to the physical root of the cause. So what is your body trying to tell you? Well, to understand its signals, we need to get to know a really crucial group of muscles that are at the very heart of this conversation: your pelvic floor. I want you to think of your pelvic floor muscles as this amazing, supportive hammock at the base of your pelvis. It's this clever sling of muscles that holds up your bladder, your bowel, and your uterus. It's designed to be both strong and flexible, to contract when it needs to, but just as importantly, to relax and let go. Okay, now this is where things get really interesting, because it kind of flips what many of us have been told. We always hear about strengthening a weak pelvic floor, right? We're told to do our Kegels, but for so many women who have pain, the problem isn't weakness at all. It's actually the opposite. The muscles are hypertonic. That's just a fancy word for being too tight, stuck in a constant state of tension. They've forgotten how to relax, and trying to strengthen muscles that are already too tight can actually make the pain worse. Just understanding that is a huge aha moment. So, if the problem is really about tension, how do we gently teach these muscles to let go? This brings us to this wonderful, gentle path to relief: specialist pelvic physiotherapy. So what does a session actually look like? Well, it's not intimidating at all. It's a partnership. It all starts with a really compassionate conversation about your story. The therapy itself involves super gentle internal work to release those tight muscle knots, kind of like a very specific massage. You might learn how to use tools like dilators in a really safe, controlled way to build your confidence, and you'll be taught these amazing breathing techniques to calm both your muscles and your whole nervous system. And you should know this approach is incredibly effective for a whole range of specific conditions. Whether it's the involuntary spasms of vaginismus, pain right at the vaginal entrance, maybe some lingering tightness from childbirth, or even deeper pelvic pain, physiotherapy gets right to the heart of that underlying muscle tension. I know the big question on your mind might be, but won't it be painful? And that's such a valid fear. But let me give you this powerful reassurance. A trained pelvic physiotherapist is an expert in pain. Their entire process is built around your comfort and your consent. Their goal, their only goal, is to take your pain away, never ever to add to it. You know, navigating a journey like this really requires a guide you can trust. That's why it's so important to know who's in your corner. So I'd love for you to meet Dr. Farzana Khan. She's a medical doctor who has dedicated her entire clinical focus to the very things we're talking about today: vaginal health and helping women get back to comfortable, joyful sexual function. Dr. Farzana's expertise is just so deep and compassionate. Her qualifications show her commitment to the highest standards in women's health. And with over 20 years of experience, she has truly dedicated her career to this work. In fact, her knowledge is so valued that she even trains other doctors and clinicians, making sure more women can get this kind of specialized care. And what I love most is her philosophy. In her own words, it's not about her telling you what to do, it's about working with you. It's all about clear explanations, setting realistic expectations, and making decisions together. She really empowers you to be an active partner in your own healing journey. Okay, so you have the right guide, but what does the journey actually look like? It's so helpful to have a realistic and compassionate idea of the healing timeline. Healing really happens in phases, and it follows your body's own biological clock. The first 6 weeks or so, that's the brain phase. Your brain is literally rewiring its connection to these muscles. Then you move into the muscle phase, where the muscle fibers themselves start to physically change and adapt. And then for pain, this nervous system phase is so key. It's where your body truly starts to unlearn that protective fear reflex, that automatic tensing up because it expects pain. This is where safety starts to feel like the new normal. So the most important takeaway here is this. Healing is not a race. Your body isn't failing you if things don't change overnight. True, lasting biological change takes time, it takes consistency, and honestly, it takes a whole lot of patience and kindness towards yourself. We've covered a lot of ground, but I really want to leave you with something you can do right now. Let's talk about your first gentle, empowered step on this path. You can start to support your own healing today. And it can be with simple things, like practicing deep belly breaths, taking a warm bath to help soothe your muscles, or trying a gentle stretch like child's pose. These things start to send little signals of safety and relaxation to your pelvis. It's really all about reconnecting with your body in a way that feels good, with absolutely no pressure. And before we finish, just a very important note. While pelvic floor tension is a super common cause of pain, it's always vital to see your doctor first. If you experience any red flags, like sudden worse pain or any bleeding, just to make sure you rule out any other underlying medical conditions. And so let's end here with a question just for you. After everything we've talked about, what feels possible now? What could your first gentle step be? Not towards some finish line, but just toward a renewed, more comfortable and joyful relationship with your own body. Thank you so much for taking this time for yourself today.